Comparative Biosciences Incorporated, and Genesis Drug Discovery and Development have joined together to provide expert scientific resources and high-quality contract research services to all sectors within the biomedical and pharmaceutical community. Comparative Biosciences, a contract research organization by scientists for scientists. Intraocular lens removal by phacoemulsion followed by implantation of an artificial lens. One of the unique customized surgical services offered by Comparative Biosciences Incorporated. We are demonstrating a phacoemulsion with an artificial intraocular lens implantation on a Dutch belted rabbit. As is with human patients, this is a well-tolerated surgical procedure in rabbits. The rabbit is similar to man in its response to lens cataract surgery. Because the rabbit eye is relatively large, it has proved useful for the assessment of both new technologies and ophthalmic surgical procedures. Every year, more than 300,000 people undergo cataract surgery to replace non-functioning lenses. Cataracts are a common cause of blindness worldwide. Treatment consists of surgical removal of the defective or cataractous lens and replacement with an artificial lens that immediately restores vision. At CBI, we provide state-of-the-art pre- and post-surgical care as well as sophisticated in-life assessments. This includes intraocular lens examination, fundoscopy, IOP determinations, pachymetry, fluorescent cornea and retinal examination, photography, ocular histopathology, and immunohistochemistry. Watch Dr. Cynthia Cook perform our sophisticated cataract surgery on a rabbit, the optimal species for assessment of artificial lens development. The surgical method includes general anesthesia and a sterile technique. The old lens is removed using phacoemulsification, which is the same technique employed in patients. Using a mechanized surgical microscope to visualize the anterior part of the eye, the new IOL is introduced into the lens bag and then deployed. This allows it to pop into place and restore vision. Biocompatibility studies for a novel lens material in comparison to the standard intraocular lens can be performed at CBI. The animal receives thorough ocular examinations with multiple readouts at selected intervals in order to detect signs of inflammation or mechanical trauma. Prior to surgery, the rabbit is lightly anesthetized and the pupils are dilated. An intravenous fluid is started along with an EKG and pulse oximetry. The eye is lightly flushed with a cleansing solution placed on the operating table, positioned properly, and draped. Next, a special surgical tool is used to make one small incision into the eye at the limbus. A fluid substance called viscoelastic is injected into the eye to help stabilize the interior and maintain intraocular pressure. The surgeon uses a delicate handheld instrument with a metal or diamond blade to create an incision in the area where the cornea meets the sclera at the limbus. This incision allows the surgeon to gain access to the interior of the eye in order to emulsify and remove the lens. Using the established technique of phacoemulsification, the internal lens is emulsified. This allows all of the hard central lens nucleus to be broken up and aspirated out. The softer outer lens cortex may then be aspirated with suction only using a hollow tip or probe. Once the lens has been removed, an acrylic foldable lens is deployed into the lens sac. The IOL will replace the natural lens and will focus light beams onto the retina. The corneal incision was created in a special way so that it will self-seal when the surgery is complete. It will close without any need for sutures. The site is closed and the rabbit is allowed to recover. What is an intraocular lens? An intraocular lens is a synthetic, artificial lens placed inside the eye. It replaces the focusing power of a natural lens, which is surgically removed. This is part of our intraocular lens implant for cataract surgery. Surgery is successful, surgery is complete, excellent recovery, no impairments, the animal recovers. Generally, recovery is complete with little mortality or post-surgical complications. Some common facts about cataract surgery. Cataract removal and replacement with an IOL is one of the most common operations performed in the United States. It is one of the safest and most effective types of surgery. In about 90% of the cases, people who have cataract surgery have better vision afterward. See our full range of services. For more information, visit our website or contact us by phone to learn more about our preclinical testing and research. Call us at 408-738-9260 or visit CompBio.com. That's CompBio.com.